So the purpose of today's session is to discuss the impact of stress on our ability to work effectively for affected communities as humanitarian workers, and to outline strategies which you can use individually and in your teams to promote self-care. So the first part of the session is talking about stress and specific presentations of stress that are relevant to our work in the humanitarian sector. I do always give a trigger warning. So if any of the topics discussed today are triggering or cause emotional upset or stress, it is completely fine to step away from the webinar if you need to. And as I mentioned, we are recording this session, so only share what you feel comfortable to share. And please do respect each other's contributions. If anything that is shared that is confidential, obviously do respect confidentiality. Many of you may be aware of the known stresses in humanitarian work. Obviously, we work in complex field environments such as conflict, and a lot of our work is working with victimized or marginalized groups or individuals. And this experience has shown itself in a very high job turnover in this sector. This is also compounded by security risks in some contexts, feeling ineffective if faced with large and what often seem like insurmountable crises. There's the job security, the job turnover, and high workload that come with it often leaves people feeling overwhelmed. And it also depends on the organization that you work for and the amount of support and training that you receive within your organization. It is the psychological problems amongst aid workers are well documented, and actually when they compare national and international staff, it is much higher. The rates of mental health problems are much higher in the national staff. So there was a study from Darfur from 2008 which showed that Sudanese aid workers were reporting much higher rates of burnout and secondary traumatic stress compared to their international colleagues. But as well as those factors which are specific to the humanitarian crisis environment, there are also contributors to stress from our work environment, so an unhealthy culture, workplace behaviours such as bullying or poor communication, high workloads and working long hours, with work that is very demanding or too hectic or emotionally demanding, but also work that is too, in inverted commas, boring or repetitive as well actually leads to stress. Feeling disempowered in your role, feeling unsupported, being given expectations which are unclear or hard to meet. And also for many professions, for my profession as a doctor, for humanitarian workers, particularly if you're working in the community that you come from, your job is often part of your identity, and that in itself brings its own stress. So think about whether you've experienced any of these factors, and then think about which of these we can change as individuals and for our teams or organizations. And when we come to work, we don't leave our personal selves behind. So personal circumstances can also impact our stress, particularly if we are from the context in which we're working, but also issues such as personal health or family issues, financial worries, or significant life events as well. So even something that should be positive and is thought of as being positive, like preparing to take some time off to go on leave, can actually, the lead up to that can be very stressful. You often have like a huge workload to clear in order to take leave. And so that shouldn't be underestimated either. Many studies have documented the huge scale of this problem within the humanitarian sector. And as I mentioned before, I will be sharing the slides, so don't feel that you have to take notes, and some of the references will be on the slides as well, so you can read in more detail. But many studies have shown high rates of a variety of mental health issues, including burnout, secondary traumatisation, depression, PTSD, excessive alcohol or unhealthy alcohol use, generalized anxiety disorder, and so on. And of those that experience mental health issues, the majority of them attribute those to working in the humanitarian sector, so to their aid work directly. And so aid workers are subject to stress, burnout, other mental health problems, as well as negative coping mechanisms, which I'll explain a little bit more in a few slides. And they experience these at about 2 to 3 times the rate of the general population. So just think, take a minute to think about for yourself or for your colleagues that you've that you've observed, what does stress look like and what does stress feel like? And feel free to type in the chat. I'm just going to stop sharing for a minute so that I can have a look in the chat. So what does stress feel like? And what does stress look like? So what does stress feel like to you? And what does stress look like when you see a colleague and you think, oh, that person looks stressed? Feel free to type in the chat if you have any ideas or experiences about that. I can do what I want. Any other? Think about, what does it feel like physically? Isolation, absolutely, that's very important. Oh, it cannot do what you want. And yeah, feeling of disempowerment, perhaps. Think about emotionally, think about physically. Feel the sensations of sickness and fear in my body, absolutely. That's very important. So if we break that down a little bit, just bear with me 1 second. Stress can affect our bodies, our thinking, and therefore our performance, our emotions, and how we interact with other people and how we behave, and that can spill over into the workplace. And there are a vast array of signs and symptoms that you may experience or that you may see in your colleagues. And this is by no means a complete list, but if we start with some of the more physical things, people can experience low energy or exhaustion or fatigue, headaches, difficulty sleeping, or feeling of wanting to sleep all the time, changes in appetite, and physical, even body aches and pains, stomach upsets, and so on. Rapid heart rate is very common. I'm sure everyone's experienced that at some point. But it also affects you cognitively. So, and that's where the impact on performance comes in. So, for example, we can have difficulty concentrating, difficulty remembering things, feelings of hopelessness and powerlessness, confusion, and this can lead to behavioral issues such as excessive blaming, and also, you can have recurrent dreams or nightmares, feelings of guilt, and resentment, shame, which again can impact your behavior. And then you may see or experience emotional lability as well. So things like mood swings, irritability. One red flag is a colleague that seems to get very, very angry over minor things, or seems to go from 0 to 10 very quickly. gets emotional very quickly and very over emotional, easily tearful, sad or angry. And also your behavior. So isolation is a really important thing. So just at the time where actually more support from your colleagues or your friends or your family could be most helpful. The tendency is when you're feeling under stress is to isolate from other people, and that can be a red flag again if you see that in colleagues who seem to always have their cameras turned off in meetings, or always seem to isolate themselves from the rest of the team. And sometimes that can be interpreted quite negatively by supervisors or by teammates. But sometimes it's worth, just having a look deeper to think to question why they're pulling away and why they seem to be withdrawing. And it may be a sign that they're feeling under stress. And what can happen if we don't address stress at work? So particularly why we worry about it. So we obviously we care about the impact of stress that I've just described. Just the impact on your bodies and your psychological and emotional well-being is important in itself. But also we need to think about the impact on our performance, the impact on the rest of our team, and ultimately the impact on the people and communities that we're trying to serve, sorry. So people have difficulty coping with tasks, which is understandable if you think back to the cognitive and emotional impacts we just talked about, and the lack of sleep and so on. You may find that people are either yourself or other people or your colleagues seem to be spending more and more time, but without accomplishing more. So you're spending more time, but it's less productive, and even taking work home, but still not accomplishing that. And that can be accompanied by a lack of morale, a reduction of enthusiasm for work, and feeling very indifferent to the results of your work, where previously people had great pride in the outcomes of their work. Again, distancing from co-workers, more errors, more mistakes, job satisfaction, feeling very cynical, feeling very distrustful, particularly of management, but also of peers. And then what happens is people start taking more and more sick leave, and that places a burden on the other colleagues, perhaps being over dependent on supervisors, and eventually that leads to an increased turnover in staff, so people leaving and constantly having to replace staff, and the impact of that, having to train up new people, and the impact of that on the services that you're trying to deliver. Negative coping strategies, so things like reliance on alcohol or prescription medications or tobacco and other substances, that's well known. But also just being very critical of yourself, taking a lot of risks. So isolating, not just at work, but at home as well, and being angry at home as well. So the stress that maybe people couldn't vent at work then comes out in the family or in the home. Sleeping a lot, so when you are with family, you're not spending much time or quality time with family, and then ultimately the aggressiveness could spill over and impact clients or patients or communities that you're working with as well. And then specific issues that I want to go on to talk about are things like compassion fatigue, and secondary traumatisation, over-engagement and burnout. So secondary traumatisation, I'm sure people have heard this term before, but essentially this is the emotional stress that comes about when an individual hears about or observes the trauma experiences of another. And so we're often very cognizant of this for people on the front line, but it's important to remember that people working at all levels of a response, when they're hearing about day in, day out, very distressing experiences of communities, of children in particular, those do have a mental health toll, even as a kind of a secondary observer or as someone hearing about it secondhand. And this can happen after one event, or this can happen cumulatively over time. And the symptoms are very much similar to what we see in post-traumatic stress disorder. And secondary traumatization is also called vicarious trauma, and it can lead to compassion fatigue. And in the general population, it's rare, but for workers in the humanitarian field who are constantly having to hear or even write about or even recount to other people the traumatizing experiences of the people that they're supporting, it's not uncommon to experience secondary traumatization. It affects people physically as well. So again, they may experience difficulty sleeping. They may have images of upsetting events, even if they didn't witness them themselves. But obviously, you build a picture in your mind, and these images may pop into your head recurrently. And it may lead to people avoiding things that remind them of what the communities or the clients are talking about. And this leads me on to talk about compassion fatigue. And compassion fatigue has been defined as a state experienced by those helping people or animals in distress, and its extreme state of tension and preoccupation with suffering of others, to the degree that it creates a secondary traumatic stress for the helper. And in actual fact, it leads to people withdrawing from the people that they're trying to help. And hence the term compassion fatigue. And the way this works is it starts off with yourself as a responder wanting to respond to someone in need. From a combination of being exposed to that, so seeing that situation is there's somebody or a community that need your help, having concern for that issue, and being empathic. So actually the people who are the most empathic are actually the people who are most at risk of compassion fatigue and burnout, actually. So they engage with the issue and they deliver an empathic response. But with that comes a level of stress. And so from baseline, your stress rises as you deal with the issue. And then as that engagement is completed, you have a sense of satisfaction, and you're able to detach because that task is completed, and that allows the stress to subside somewhat, but it never goes back to baseline. And then you go on to the next case, or the next patient, or the next community or crisis that you're dealing with. And so you can see that because you never return to baseline all the time, this is your baseline level of stress is rising and rising. So your residual level of compassion stress from the previous engagement is being built on each time. And when you have prolonged exposure to suffering, you don't have the opportunity to detach. You don't even have the opportunity for your stress from your original empathic response to subside at all. And if you are not seeing immediate results because crises are protracted, ongoing, maybe even escalating, then again that impacts your level of stress and the ability of your stress to subside. And then we combine that with the traumatic memories of what has gone before, and your other life demands, because as we said, the humanitarian responder is also a human being with other things going on, plus perhaps stresses from the work environment as well. And all of those combined lead to a situation of compassion fatigue, where you end up with the people who are the most willing, the most empathic, and the most able to respond actually then withdrawing and being no longer able to respond. And that shows itself in things like increased sickness, absenteeism, and increased staff turnover. And that again makes it worse for the people left behind, who are smaller in number and coping with a larger workload as a result. And this other diagram is it just talks about the different components of stress. And as you can see, you only need one of those components to be out of kilter for us not to be able to harness our full compassionate selves. And tolerance of distress is one of those 6 components of compassion. Just to say a few words about over-engagement. So over-engagement happens when the relationship between a provider and their client or patient or community or whoever they're helping becomes deeper than a normal professional relationship. So the normal professional boundaries are blurred, and that's accompanied in the provider by a feeling of doing too much, but always feeling like it's never enough. And people end up thinking about their beneficiaries or their clients or people that they're helping after work, and perhaps that leads to giving additional special care or spending more time with one person, and having an increased feeling of responsibility and being annoyed if any barriers occur. And that could be if other colleagues are contributing to the work as well. That can often lead to conflict in the team as well. And so if you see that happening and it seems a little bit irrational, that might be what's happening. They may be spending their break, their time off with the beneficiary. They may become socially involved with them. And this is harmful for many reasons. Obviously, it affects the service because you're no longer able to deal, equally with all of your workload. It may develop a dependency, and that person may come to rely specifically on that one person. And then what happens when that one person is not the appropriate person for a specific problem, or is not available? So that can actually be quite harmful for the affected communities as well. Sometimes people can refuse to hand over care to another staff. So again, if you see behavior like that, it is a factor of this over engagement, and it is a factor of stress and over tiredness and not having time away. And actually the most supportive thing that you can do for a staff member in that situation is actually to like compassionately and supportively withdraw them from that situation and help them gain a bit more perspective. And I think we've all heard a lot about burnout. Burnout is positively correlated with general distress and secondary traumatization, and negatively correlated with compassion satisfaction. Burnout is the thing that we're trying to avoid. That is the end result, where people are stressed, but no longer trying to do more and more in order to try and make themselves feel better and try and get on top of their workload or deliver what they think they need to be delivering. Actually, people are withdrawing, people are very flat, people are very disengaged, their morale is very, very low, and they are probably or at risk of being on their way out if they don't have a significant period of time away from work to reset at that point. So the point about burnout is if we can recognize the warning signs early, we can try and be proactive and prevent burnout in most of the cases. Now, sometimes when you're in a leadership position, you might be a very good leader that thinks a lot about looking after your team. And actually, I can see someone's raised their hand. Hassan, did you want to ask a question? Let me stop sharing for a second so I can see the sorry.
Hello, thank you. I have just
Yeah, Hassan, did you want to say something?
Nothing. It was a mistake. I raised my hand by mistake.
Oh, no worries. Okay, don't worry. No worries
Just
at
to
all.
say hello. Hello, how are you? Fine.
Okay, great. Thank you.
Hope you are fine.
Yeah, great. Fantastic. And it's good to see you. I will just go back to talking about the burnout leader. Um so we've all had very good leaders who are very good at looking after their team, but a good leader should also look after themselves. And if you have a leader who is burnt out, that compounds all of these issues for the team. And there have been studies done which show that the impact on the team is negative morale and increased turnover in the team as well. And as you can see, there's a vicious cycle. So once you have negative morale within the team and increased turnover, that lowers the satisfaction, job satisfaction, and increases stress for the people remaining in the team who are dealing with an increased workload, compounded by new people coming into the team who may need training and support, and that then leads to more stress for them and may lead to more absenteeism in them, and then they may leave, and so on. And so that just becomes a vicious cycle of stress in the team, leading to absenteeism, leading to increased staff turnover. And you can imagine the impact of that on the services that you're trying to deliver, and that can be very difficult. I can see there's a couple of hands up. So I'll take, oh, the slides are in the presenter mode. Oh, apologies. Let me share them again. Okay. Apologies, one sec. Okay. Is it still in presenter mode? Don't know if someone can unmute and let me know, because I can't see the chat.
It's not a presenter's mode.
Oh, perfect. All right. Apologies about that. It's not a given that every demanding job will lead to burnout, and every non-demanding job means that everybody's fine and don't experience stress or burnout. It's actually a balance between the demands of the job and having appropriate resources and support in place in your organization. So actually, a very demanding job can be very rewarding and fulfilling, and people can stay in post and do good work with appropriate resources and support. On the other hand, you can have a job that is undemanding in terms of volume, or in terms of complexity, or in terms of the emotional demands of the job, but people don't feel supported. Maybe the workplace behavior is not a nurturing one, and people can still develop stress at work and can still lead to absenteeism and job turnover. So what we're aiming for it's not always just thinking about the demands of the job, but making sure you have the appropriate resources and support for the demands of the job. And that includes things like training, as well as having an appropriate workforce if you can, time away when you can, and thinking about the team culture. And that's what we're going to go on to talk about next. But this is what we're trying to aim for. So a balance between the demands of the job and the resources, where you have a culture of wellness and institutional support that is able to balance the physical and emotional demands of the job, and hopefully prevent burnout. So what I'd like to go on to talk about now for the rest of the session is what we can do about this, and specifically talking about self-care, which is essentially looking after the body, the mind, and also our emotional well-being. And for some people, that includes your spiritual well-being as well. And that includes some of the things that are shown here, like taking a step back, asking for help, forgiving yourself, and so on. Staying at home, which means sometimes like taking a step back. Setting boundaries for yourself. We can all practice self-care to prevent stress, compassion fatigue, or burnout. And we should do that even if, from the top, so that you are leading by example. And we can use it to slow down or reduce the symptoms, so to manage our stress. We cannot always prevent stress because we work in stressful jobs and stressful environments. And a small amount of stress, when managed, can help us to perform well. What we need to do is to be able to manage our stress, and to slow down or reduce symptoms of stress that can be harmful. But we can also use these principles to help us identify when we might need additional help, such as counselling. So again, I'd like to, if I stop sharing again, actually I access the chat. If I can ask you to think about and just type in the chat, what do we do for a healthy mind, a healthy body, or healthy emotions, a healthy emotional state? So just going to give people a couple of minutes, if you'd like to type in the chat what you do to keep yourself healthy physically, emotionally, and so on. Get enough sleep, absolutely. Meditate, exercise, do something creative, dance, draw, sing, absolutely all of those things. Work out, yes, exercise, very important. Long drive, that's interesting, and sleep. Traveling, okay, that's a good one. So fantastic. So you all have lots of ideas of things that we can do, and what's important is trying to build a routine, build this into our daily lives, particularly at the time when we think we don't have time to do these things. That's probably the time when we need to make time for them. And so some of the self-care strategies are seen here, and a lot of these you have mentioned already as well. Social activity. So I mean, we do need to be able to practice our own self-care individually, by ourselves. But where it is possible to get together with our teams or with our families or our friends, we do benefit from our connections with other people. And as we mentioned before, when we're feeling under stress, we tend to self-isolate. And what we really need to do is push ourselves to make a bit of time to have a coffee with someone, to catch up with somebody, something like that. Some teams have a little kitty, so everyone puts in a little bit of money, and then once a month they have like a meal together, or do yoga together or something like that, play football together. So sometimes with your teams you could plan something. It doesn't need to be very expensive or elaborate, but something that allows people to get together and relax together. Allow yourself time to process your emotions. Don't try to suppress them. You're allowed to have emotions. That is normal and natural and healthy. And practicing mindfulness, and also learning breathing techniques. So if you go online, you can look at, there are a lot of breathing techniques, such as box breathing is a good one. Essentially, what they do in general is they encourage you to spend more time breathing out than you breathe in, and that helps you to slow your heart rate down, and calm down. And I remember one young doctor when I was working abroad, and when she was on a busy emergency department shift, and you can't always go and take a break in the way you would like to, but she said that what she used to do is I just go outside, I lean against the wall, and I sip from my water bottle slowly, and that lets me calm down. So there, think about small things you can do in the moment. If you can't leave work, but you can take yourself out of the environment for 5 or 10 minutes, and just allow yourself to calm down physically and mentally. So the American Nurses Association defines self-care in this way. So including this very important part about listening to your own body and recognizing and intervening when you're noticing signs of exhaustion. And I would add signs of stress to that. So all the things that we talked about earlier on. There are a range of self-assessment tools and checklists, and they can be very useful as individuals. We can use them to keep a check of ourselves. It's very important to remember, particularly as managers, that our role with these is not to diagnose. Anyone who is suspected of having emotional or mental health problems should be referred to a qualified professional. However, I have used such tools anonymously to check staff department by department, so they can give you regular anonymous pulse checks, and that can help you guide strategy. So for example, where should you direct resources in terms of psychological support, particularly if you have limited resources? And these tools often need contextualization and adaptation for your local contexts and cultures, and I've certainly had to do this. This is the most appropriate one for our sector. So the Headington Self-Care and Lifestyle Inventory was designed specifically for the humanitarian sector, but I would still say usually needs contextualization for different cultures or contexts. Again, it's not diagnostic, and if you suspect someone needs mental health support, they should be referred to an appropriately qualified professional. But you can use this for yourself as a way of checking on yourself, and according to the score, it tells you kind of where you're doing and whether you need to do more or whether you're doing well. And there are other tools as well that you can have a look at when I share the slides, and they're given there. But the Headington tool is highly recommended, realizing that they will need contextualization. So what is our responsibility as managers or leaders? So in our sector, there has been a prevailing focus on traumatic stressors as the main predictors of worker well-being. And this is more of a medical model perspective that places most of the emphasis on mental health and puts the responsibility on individuals to identify issues and secure treatment rather than on the organization. So as managers or as an organization, we also have a responsibility to systematically prevent or reduce work stresses and job strain. And really what you need is a multifaceted approach that's able to support individual strengths and resilience. That includes manager training, so that you have an organizational culture with a high level of psychosocial safety. And so what we need is actually this triad of mental health promotion. So you need to make your staff aware, and I'd be happy for all of you to take this back to your staff and share these slides and discuss it and see how can we apply this, in reality to our practice. But also people management is very important, and that requires training for line managers and also organizational culture. So if staff think that if staff feel that the organization invests in them, cares about them, then what you see is increased commitment, increased motivation, and people appreciate their roles. If you have psychological services provided, then what you see is reduced burnout and reduced staff turnover. And psychosocial training as well, even just making people aware of these issues and simple self-care strategies can help reduce burnout. And when you have positive support from your leaders and your colleagues, again, you increase fulfillment, you reduce burnout. Support from managers needs to be supportive. So sometimes we do have to review performance. We do have to continuously improve so that we do the best for the people we're trying to serve. But that has to be done in a way where it is psychologically safe for people to reflect on their performance, what they've done well, and any mistakes that they've made. I come from a profession where mistakes can be devastating. So you have to be able to reflect on your practice, or support staff to reflect on their practice in a way that is safe and that is promoting learning from experience and not promoting a blame type culture, or a self-blame culture even. And some of the barriers to this are just our culture in the humanitarian sector. We come from a very old sector where the culture was originally colonial, quite frankly, and there is this kind of hero, macho, martyr culture still embedded into our humanitarian sector. There can be a lack of trust, so studies have shown that if you use external counsellors, then they will be trusted and will be more effective. If they're internal counsellors, people worry about the impact on their own employment, and lack of specific training. So managers need to be trained in supportive supervision, and people need to be trained in psychosocial awareness and self-care techniques and strategies. There's also a lot of stigma, and studies from the Middle East region show that, and other regions around the world, show that people express their psychological distress in terms of physical symptoms, and that's because of a stigma associated with mental health issues and talking about stress or anxiety. And so we need to be cognizant of that, and we need to be supportive of people and think about, if you're seeing a large amount of sickness leave in your team, then think about why that's happening. So think about how can we bring self-care to our work as individuals and as teams, and this is what I would like to end with, and to ask people to go away and talk about and do within your teams. Think about what you're doing already. Think about what you could do more of, and what would you like to start to do. And what I would recommend is a three-tiered approach, which starts with self-care, so making people aware of stress, making people aware of self-care activities, healthy mind and body. Make this training mandatory to raise awareness and reduce stigma around the issue of stress and mental health, and maybe providing some self-assessment tools as well, and encouraging people to use them, and you don't have to see them. And then go on to team strategies. So you may have group activities, supportive supervision or peer mentoring, and early identification and intervention, which may involve that anonymous use of checklists. And then the third level is specialised. So that's where you will need your external, ideally, provider, where you can refer for psychosocial support, or you can allow people to self-refer. And just do think about conflict of interest. Again, so this is why externally provided counselling services with self-referral are best. It may not be appropriate for HR or a line manager to be doing that. And when the information is needed to process payment, you need to make sure that that's done in a way that maintains confidentiality, so that only the correct level of information is passed on. Line managers need to be trained to be supportive, and to be able to gently and respectfully recommend. You should never refer without consent. You should never recommend in a way that is disrespectful. You need to think about, how can we destigmatize mental health? Could you send out like an email, like a message on a Friday afternoon or something, just short messages that you could send out, posters, text, things that are no or low cost. And very, very importantly, it is not for line managers to be tackling case management themselves. They're not trained to do that, and there is a conflict of interest there. So I just wanted to end by saying that self-care is not selfish. It is important that you invest in this for the well-being and good functioning of yourselves, as humanitarian workers, as role models, as educators, as family members. It is essential. And so therefore your self-care is essential. And remember, so we have this saying, you cannot drink from an empty cup. So fill yourself up and you'll be better equipped to be able to support other people. And so thanks very much for listening to that. And so I'd just like to invite anyone in the last few minutes, if they have any comments or questions. We can take one or two questions, and if people have any experiences of things that you do in your teams that you might like to share. Hassan, your hand is still raised. I don't know whether that's still a legacy hand. Jonas, you're welcome. And I will share the English as well as the Arabic slide decks as well. And yeah, I'll share some resources for you as well. Can't actually see the Q&A box at the moment. So we do have a minute. If I'll just give people a minute if they do have any last minute questions or comments. So additional resources, courses that you can take in support. So oh, no questions in the Q&A. Thank you. If I can just, so Nermeen has asked, are there any additional resources or courses you can take with a focus on supporting your teams? So I would suggest courses on things like supportive supervision. HLA have a lot of coaching and mentoring resources available. So perhaps I could, when I'm sending out some resources, perhaps can provide you with some links for coaching and mentoring courses as well. We do provide more in-depth training. So feel free to contact us at HLA, and my contact details are on the slide deck, but we can provide more in-depth or more sector-specific training on this topic, where we can go into more depth about the supervisory aspect of it as well, and sometimes professional frameworks as well that we can talk about. So we can definitely do that. So for that question, two options: some pre-existing resources that I can send out, looking up, three options: looking up local resources around supportive supervision, coaching and mentoring, etc., or contacting us for something more customized or tailor-made for your specific area of work. What do you do if a new director is from another sector and just does not see this topic as important? So it's a very, very important question. I've experienced that too. So I come from the medical profession, and actually we were very late to the party. And I mean, my interest from this stemmed from wanting to investigate how do we provide compassionate care in a low resource setting. When I was working in hospitals, you know, in low resource setting, very overwhelmed, overworked staff. And again, the same issue. Medical profession is very like the humanitarian sector in terms of that kind of hero culture. You know, you're not supposed to admit any vulnerability. And so the first thing was really just giving talks like this to our leadership, and just educating people on the importance of self-care, and showing how it actually, you know, it reduces absenteeism. You know, it improves productivity, it reduces staff turnover. So it actually is important, you know, there's a business case for it too. It is also just a responsibility of all organizations to look after their staff. But sometimes that kind of business case type argument goes down better, and also, you know, giving a bit more information about how stress can manifest itself, that it actually impacts the performance, so the services you're delivering are not going to be as effective. So that's also important. So that's kind of how I would approach that. And again, my email address will be on the slide deck, so happy to discuss that more if people need support in putting a presentation. The slide decks, I'm happy for you to just take them and use them as you like. What should I do if management is restricting responsibilities, even though I want to take on more tasks, and this is causing me frustration at work? So, with that, I mean, obviously I can't answer that fully because I don't understand the specifics of your particular circumstance. But what I would say in general is, first of all, ask yourself, where's your frustration coming from? Is your frustration coming from a place of stress, or is your frustration coming from a misunderstanding about your scope of work or something like that? And so I think from the, within the scope of kind of self-care and stress management, it is worth just doing a little self-check on yourself and thinking that through. And then it's always good to have, if there's a peer, if you can't talk to a manager, it's always good to have maybe peers that you can reach out to talk things through. So that's another thing, actually, when somebody was talking about resources, actually resources on peer mentoring can be helpful too, so that can teach you how to have structured discussions with each other to structure kind of reflection around issues that you are facing, so that you can then work through issues that are causing you frustration in a kind of calm and structured way. We're actually at time now, so I'm going to thank everybody for the very good questions actually at the end, and for your attention. As I mentioned, if there's any question or comment that I didn't get to in this session, then feel free to email me when you get the slide deck, and I'll send out slide deck with this recording and other resources in the next few days. So I wish you all a restful and safe rest of the day. Thanks very much for joining, and hopefully see you on some other webinars in the future. Thanks very much.